Deficiencies of vitamin D are very, very common. Millions of people have it. Dr. Krystosik here, aka Dr. Good Carbs, and today I'm going to share with you how to prevent disease with vitamin D, including those colds and flus during the winter time. I'm going to winterize your body. Just make sure you subscribe to my channel so you can stay updated on all the important news we bring you on natural medicine. Vitamin D is very important for several functions inside the body. It helps with absorption of calcium inside the gut. It also helps to make sure that we don't end up with brittle bones. It makes a strong immune system and also protects our heart and helps us to not end up with depression. Oh, by the way, it also helps to decrease inflammation. But there's not a lot of foods that have vitamin D in them. Most of the vitamin D is found in fatty foods like fish and other meats and eggs. A lot of other foods don't have vitamin D in them. So we really need to make sure that we're getting vitamin D either through the sunshine or taking foods that are fortified with vitamin D. Most people don't know that vitamin D is fat soluble, and you must take your vitamin D supplement with foods on your tummy that are fatty foods. It could be nuts, it could be some fish, it could be some kind of fatty food, but it needs to be done properly during the time that you eat, not on an empty stomach. And by the way, don't take it at night because the vitamin D will compete with melatonin. Be careful that you take it at the right time with the right foods. Okay, so what's the best source of vitamin D? Is it D3, which is derived from animal sources, or is it D2, which is derived from plant sources? Well, the research says that vitamin D3 is somewhat better absorbed in the bloodstream. However, either one's going to pack a punch against those winter bugs that are floating around in the environment. So I encourage you to get out and get some sunlight. And by the way, if you're out in the sunlight for just 30 minutes, the research says that you're going to uptake between 10 and 20,000 international units of vitamin D. So what is the recommended daily dosage? A paltry 600 IUs. So in my estimation, to protect yourself, take a higher dose of vitamin D and protect you and your family. I take 10,000 IUs per day during the winter to winterize my body, to protect my body, to put a shield up against those viruses. Oh, and here's another really important point that you should remember and talk to your doctor about, because the medications, many medications, will cause the vitamin D absorption be decreased. So there's lots of medications that cause it, but let me give you a few. Antibiotics, which are used a lot here in this country, blood pressure medication, and proton pump inhibitors for people who have acid reflux. Those are some of the major ones that people use a lot, and they cause a deficiency or lack of absorption of the vitamin D. Now, another thing to be aware of is that people who are taking vitamin D oftentimes are deficient in magnesium. Now, magnesium deficiency is very common. As a matter of fact, probably up to 50% or greater of the population are deficient in magnesium. And that particular mineral and calcium are very, very important. So we really need to make sure that we get magnesium. And where are you going to find magnesium? Well, it's in the good carbs. What do you know? Things like fruits and vegetables and whole grains and nuts and seeds. And a lot of people are steering away from those. That's why I really advocate as Dr. Good Carbs to eat lots of whole food carbs. You can't go wrong. Don't avoid those carbs. Make sure you're eating the right carbs, not that refined stuff. Remember, as I always say, the whiter the bread, the sooner you're dead. Stay away from that white flour, the white sugar, and all those white poisons. Magnesium is very important for the nervous system. It calms the nervous system. It has many different functions to help to activate the nervous system. It builds muscles. It helps to strengthen the muscles. It relaxes the muscles. It also helps to lower blood pressure. So magnesium is very important. There's over 500 enzyme actions inside the body that magnesium is involved in. So magnesium is so important, and it helps to get calcium into the bones. And you don't want to end up with brittle bones. And if you don't get enough calcium, that'll happen to you, and you'll end up with things like osteoporosis. So magnesium is extremely important. Now, magnesium supplements. I want to talk about that for a minute, because a lot of people are taking magnesium supplements thinking, oh, I'll bypass eating the good carbs and I'll take magnesium supplement. Well, you can't fool Mother Nature. The best source is always foods. Remember, food is the best medicine. Now, if you're going to take a magnesium supplement, don't get the cheap things that you'll pick up in these discount houses, and they end up with magnesium oxide, which is a very poor quality of magnesium supplement. You only get about maybe 10% absorption of that. You want to take glycinate or citrate, magnesium glycinate or citrate. Those are the best forms. Try to get a lot of green foods. The center ring of chlorophyll in green foods is magnesium. So it's important that you eat your greens, just like your mom told you back in the day. Now, vitamin D, back to that. It can become toxic. And so we want to make sure we get the right amounts, and we can have our blood tested. So you can test your vitamin D levels in the blood. It's a very easy test to be done. Your doctor could do it for you. And it's tested in nanograms. And the normal average range is between 30 and 60 nanograms. And if you're low in it, it's like between 20 and 30. And if you're less than 20, you're really deficient. So you've got to be careful. Now, if you take too much, it can become toxic. The toxic levels are at 100 nanograms. So get your blood tested and make sure you fall within those ranges. And be sure to follow the specific recommendations that I gave you today. And I encourage you to follow us on the other side of medicine, to learn about how to take care of your body, not only during the winter, but all seasons long, so you can stay independently healthy. That's what I want for you. So I'm Dr. Krystosik, aka Dr. Good Carbs. Until next time, ciao for now.